Today, we will discuss Crohn's disease. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Crohn's disease is a long-term condition that causes inflammation in the digestive tract. This can lead to symptoms like stomach pain, diarrhea, fatigue, weight loss, and sometimes fever. The inflammation can affect different parts of the digestive system, often leading to flare-ups where symptoms worsen. Signs you might have Crohn's disease. 1. Stomach pain, cramping or pain in the belly. 2. Diarrhea, frequent, sometimes urgent, need to go to the bathroom. 3. Weight loss, unexplained weight loss due to difficulty absorbing nutrients. Fatigue, feeling unusually tired or weak. 5. Nausea or vomiting, feeling sick to your stomach or actually vomiting. 6. Blood in stools, this can be a sign of inflammation or bleeding in the intestines. What to do? If you experience these symptoms, especially for an extended period, it's important to see a doctor. They can perform tests like blood tests or imaging to help diagnose Crohn's disease or rule out other conditions. Early diagnosis and treatment can help manage the disease better. If someone has Crohn's disease, here are some simple steps to follow. 1. See a doctor. Get a proper diagnosis and treatment plan. 2. Take medications. Follow the doctor's advice on medicines to reduce inflammation and manage symptoms. 3. Eat healthy. Focus on a balanced diet that's easy on the stomach. Avoid trigger foods that worsen symptoms. 4. Stay hydrated. Drink plenty of water to prevent dehydration, especially if experiencing diarrhea. 5. Monitor symptoms. Keep track of what helps or worsens symptoms to share with the doctor. 6. Rest. Get enough sleep and reduce stress as both can affect symptoms. 7. Join support groups. Connect with others who have Crohn's for advice and support. Always follow your healthcare provider's recommendations for the best results. In the hospital, here's what they typically do to help someone with Crohn's disease. 1. Check symptoms. Doctors will ask about symptoms and do tests to understand the situation better. 2. For fluids. If the person is dehydrated, they may receive fluids through an IV to stay hydrated. 3. Medications. They may give medicines to reduce inflammation and relieve pain. 4. Nutritional support. If eating is difficult, they might provide special nutrition through an IV or feeding tube. 5. Monitoring. The medical team will keep a close eye on vital signs and symptoms to ensure the person is stable. 6. Surgery if needed. In some cases, surgery may be necessary to remove severely affected parts of the intestine. The goal is to stabilize the patient and manage symptoms effectively. Here are some commonly used medications for managing Crohn's disease. 1. Aminosalicylates. Mesalamine acetol Lialda helps reduce inflammation in the intestines. 2. Corticosteroids. Prednisone reduces inflammation quickly during flare-ups. Budesonide Entocort, a newer steroid with fewer side effects for mild to moderate cases. 3. Immunomodulators. Azathioprine Imuran helps suppress the immune system to reduce inflammation. Methotrexate, another immune-suppressing drug used for some patients. Biologics. Infliximab Remicade, a biologic that targets specific parts of the immune system. Another biologic that helps reduce inflammation. Antibiotics. Metronidazole, often used if there are infections or abscesses. Always consult a healthcare provider for specific treatment plans and medication choices. People at an increased risk of developing Crohn's disease include 1. Family history. If someone in your family has Crohn's, you're more likely to get it too. 2. Age. It often starts in young adults, usually between ages 15 and 35. 3. Race and ethnicity. It's more common in people of Jewish descent and those living in industrialized countries. 4. Smoking. Smokers have a higher risk of developing Crohn's disease. 5. Diet. Eating a diet high in processed foods and sugars may increase risk. 6. Environmental factors. Living in urban areas or having had certain infections might play a role. Being aware of these factors can help with early detection and management. Now, you need to watch my video on COPD or have a look at pneumonia.